The only approved targeted therapy in early-stage lung cancer that's approved is osimertanib based on the ADAURA trial results. And patients are getting osimertanib post-resection and receive osimertanib up to 3 years. So outside of this, there are no other targeted therapies that are approved by the FDA in the United States for early-stage lung cancer. So NAUTIKA1 as well as other trials are looking at targeted therapies in really the perioperative space to give it neoadjuvantly and also adjuvantly. There's also a separate set of trials that look at adjuvant targeted therapies. So this is an exciting time where we know these drugs work in late stage, and we really want to see them move to earlier stage and receive approval and become standard of care. So this is one of the trials that are trying to get approval ultimately to phase 3 trials. This is a phase 2 trial, but ultimately to registrational trials that will lead to approval of targeted therapies in early stage landscape. So this is an excellent point about mutational molecular analyses in early stage disease, and this is certainly a challenge to figure out the mutational status. And some institutions like ourselves at UCLA, we're doing reflexive NGS testing prior to surgery because we have a portfolio of targeted therapy trials that we try to enroll into. But no doubt that there's a challenge with NGS testing, particularly as you expand the panel, and particularly in community practice, I think this becomes problematic. There's a lag time from the time of biopsy to send out of that tissue to get it tested, to get NGS testing, and then a turnaround time, which is usually around 2 weeks. And one of the downsides is sometimes the tissue that's sent out is not sufficient, and you can't run the analysis. So there's definite challenges in the preoperative setting, but this is definitely an area that needs to be improved upon and needs to be worked out. I think many academic centers have sorted this issue out, but know that that's a challenge is NGS testing in the perioperative space. In the adjuvant setting, post-resection, you have a built-in time where the patient has to recover from surgery, so there isn't this rush to get the NGS testing done right away. So adjuvant trials in that respect have been more well received because in terms of logistics of the NGS testing, it's easier post-operatively.